On today's episode of Beyond Resilience, Jamie and Catherine are talking about the challenges and emotions around surveillance scans for cancer patients and survivors. We're exploring how this opens opportunities for personal growth and empowerment that comes with facing and managing the fear of cancer recurrence. As always, we're glad you're here.
Hey, happy to be here today. How are you?
Yes, I'm doing really well. I'm doing
Good.
okay on
Yay.
this beautiful emerging spring day here. So
I love it. I love
yes.
it. Well, it's getting warm where we are. So, but the sun is shining and that's all really, really good. So I'm just excited to talk about today. It's going to be a goodie.
Yes, I agree. So before we jump in, gotta ask, what's on your heart today?
What's on your heart? Oh, well, lots of things actually, but on Monday, I was able to drive up to see my son and my daughter-in-law, who I just absolutely love. I call her my daughter-in-love, and she is just an absolute sweetheart. She's due with their first baby, and it's just the cycle of life. It just makes me think about bringing in a new baby is fresh and exciting and so wonderful and innocent, and all these wonderful things that we kind of want to be rebirthed with them. So that's really what I'm really thinking about. How about you? How about you, my friend? What's on your heart?
I love that. So, I'm feeling really grateful today. The last few weeks really have been a lot for me. I've been kind of doing some personal work, that's been pretty heavy. And I feel like over the last few days, I've had a chance to have some really quality time with my kids. And then I've also just had some amazing work with clients that I've just had the privilege of sharing some space. And I'm at a place, right, where I've been able to really bracket my own stuff and do some great work with clients, and then take a breath and go back to it. And that's all. Like, I feel like things are good. I'm really grateful. So
that makes me happy. That makes me really happy. I think establishing some healthy boundaries is hard, but it's a necessary thing we need to do, in our relationships. And I would think when you're pulled in different dimensions in your coaching practice, that can be difficult without bringing that inside and letting that have a place in your heart. That would be difficult for sure.
Yeah. Yes, absolutely. And, I think I don't know, in the past, right, my mode of dealing with things, of making my way through life and through busy life, interacting with people with lots of stuff going on, was really just to sort of push my stuff down, right? And never go back to it or deal with it. I was an expert at that. And so taking the time and space and really learning myself how to process grief, how to process trauma, and still live life in the moment. Also be present in each day. Took some work, right? That was not easy for me to begin to do. And I would say I'm still, I'm evolving, I'm learning, I'm growing, and and I'm grateful. I'm doing it. So
I love it.
That's me.
I love gratitude. It always makes us just feel so good, doesn't it? It's like taking our happy pill. I love being grateful. We have to work at it, but it is a wonderful place to be.
Yes, definitely.
So what's on slate today, Coach?
Yes.
What are we going to be addressing today?
Yes. So, one of the things that I know that I've done a lot of work with folks on, and that I think is resonant for you as well, is that feeling of having scans come up, surveillance scans, labs, right? Depending on, for people with liquid tumors, if you will, leukemias, maybe it's blood work that's coming up.
Yeah.
Breast cancer survivors, certainly, different kinds of scans.
Yeah.
So those, off-treatment surveillance scans to look for any evidence of disease, and the anxiety and other feelings that come up as that time approaches, and then even having to go into the clinic, go into the scanner, go into the hospital, whatever it is. That's a heavy time.
It is a heavy time.
We just wanted to, I think, spend a little time talking about, this is coming up. I'm overwhelmed. I'm scared. I'm whatever. Help me out. What do I do? How can I deal with
how
this?
How to process those emotions. Yeah.
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 So I can see as I say that, even the, your expression, I can see just maybe a little emotion coming from your expression. I'm wondering if you would be willing to share a little bit about your experience and what's going on for you in this moment.
Oh, scans are hard. Scans are really hard. I feel like they're a necessary evil, good, all of that stuff. But they're hard. Do we want to know? Do we not want to know? And of course, we should know, right? Because we need to. If we think about what happens, and I'm pressing a replay button here about my breast cancer diagnosis. Oh, if I only would have known. If I only would have known. We didn't do anything maybe deliberately to cause breast cancer or cancer. It's not our fault. But maybe if we did a little something differently and we process this a little bit differently, it's hard not to kind of think about those things. If I would have only known. And a scan is a little bit that way to me. It's okay. Now I get to know. I get to know this, and what am I going to do about this information, and how am I going to, mindset go into it, number one, and then process the information in the waiting time. I think that's a really tough time after you've already had your scan and you're waiting for the results, and you're just not trying to be consumed about it, but it's hard not to be consumed about it, and so. Having some strategies to deal with that waiting period in between scan and results is probably something to talk about too.
Absolutely. Yeah. So I hear you reframing, right? I hear you saying, I get to have this information. This is empowering, and at the same time, I hear you saying, it's hard to not be consumed by those thoughts. And I'm wondering about, one, what some of those thoughts are for you, and two, what do you feel in your body as you even talk about those thoughts?
Yes, I think even thinking about those, right? Like thinking about the whole idea of having to go in and getting those scans, even though I'm not part of a surveillance anymore. I went through a hefty amount of scans in the beginning of the year. So I was able to have that muscle memory of scanning again and waiting for that. But, I think it's just fear. I think you just fear. We don't mean to, but I think it's easy to jump to the worst conclusion. And that's the wrong thing to think about, because we don't know, right? So we can unnecessarily pull ourselves into this downward spiral of gloom and doom when we don't know anything. I mean, we've just gotten a test done, but our minds can get the best of us and elicit this emotion that maybe is not going to serve us in the best way, being stressed out for something that we don't really even know.
Yes.
And so I would say, when you're seeing patients, Jamie, what is your response to that when you're in the waiting period, maybe before or even after? Because it's kind of the same thing. The scan may or may not reveal anything at that time. The actual, it's scary, but then we have to kind of relive that before and after kind of thing again. So what do you say to a patient that is, I have to get a scan, or I've just had a scan done?
Yeah. So So I'll answer your question, and I just am transparent in that I have some things that you said that I do want to touch a bit more on as well.
Of course.
But I think, to start off with answering your question, more than anything, I normalize it, right?
Mm-hmm.
Of course you're scared. That makes total sense. And, depending on the person and the situation, sometimes that fear can be more intense if you haven't had a chance to go back and process the fear, the sadness, the grief associated with the original diagnosis, right?
Sure.
Because a part of what's coming up is some of those leftover feelings, or what may be coming up, and then the fear about the what ifs.
Right.
Oh my gosh, right?
Right.
This can't happen. It can't come. I don't know what I'll do. The overwhelm. And so first and foremost, it's normalize and allow it. Sit with it. Yes, allow those feelings to come, to work through, to spend some time with.
Oh, it's uncomfortable. Yeah.
Yes. Yes, it is. It is uncomfortable. It is uncomfortable. And the reality is, if we shove those down and don't spend any time with them, they don't go away. Right? They're still there.
Yeah.
And allowing them to come really allows you to get to the other side of them.
I like that.
And really acknowledging, yes, I am scared, and I'm scared that, how will I deal with this if this comes back? Will there be a treatment? What might that treatment look like? And what if I die?
Yeah.
Right.
Right.
And so spending time allowing that, and then doing whatever you can to really be present in the moment, right? To be present with your experience. The other piece that I always try to highlight is, yes, it would be hard to have a relapse, right? It would suck. We don't want that to happen. Nobody wants that to happen. And so the wonderful thing about those surveillance scans or labs, I'll throw in, right, is that they allow us to pick up any evidence of disease coming back at as early a point as possible, so we can do something about it, right?
Right.
To really maximize the chances that we can take care of it, right?
I love that.
Yeah. The other piece that I highlight, often not in the context of this particular conversation, but at some point in that survivorship visit, often after we've talked about the scan results and gone through that, but is to talk about the importance of wellness, right? Yeah. The opportunity, the wonderful thing about being healthy, about being disease-free, and not having to be in the midst of treatment and all the chaos and challenges that go along with that, is you have this opportunity to strengthen, to feed your body with, nutritious foods and fresh air and time to be grounded, and ways, very personal ways to manage any anxiety or depression or other things that are going on, to have your body in the best place possible to stay healthy. And if there would be any evidence of disease, to be in the best possible place to fight it, right? To successfully receive and get through any potential treatment, and get to the other side of it. So
I agree.
So those are kind of the pieces.
And I feel like when you're talking about all these wonderful things, we're putting ourselves in that position, that place to fight through it. We can look through that lens, that empowering lens, when we need to go get our scans done, when we need to do our lab work, when we need to do surveillance, as I am strong, I am strengthened, I am empowered, I am a fighter. And when we look through that lens a little bit differently, and of course, we have to do all the intentional work to get there. It just doesn't happen.
Sure.
We have to work at that. But when we do that, then we're able to really sit in that place of the waiting period, the before and the after, in a much, much better, healthier place than when we're just kind of sitting and waiting. We're in this place of, well, I just can't deal with that right now. I don't want to think about that right now. It's too much for me right now. But when we're addressing it and we're sitting in it and we're getting that other side, we're getting stronger, we're putting on our armor, we're being intentional about our lifestyle choices. And that, my friend, that is what is going to help us look at our scan surveillance maybe in a different light, maybe even a place of gratitude that
Absolutely.
we get to do this because this means this is one more step towards my a healthier place for me.
Absolutely. Yeah, for sure. Yes. So I'm wondering, when you are in the middle of those feelings of fear or overwhelm as you're waiting for results or as you're waiting to go in, and what are some of the strategies that you use to?
Yeah, that's a great question.
I
mean, there are lots, and I have learned this, not being a psychologist or a counselor. I've learned this from other people, but I love the idea of stop, drop, and roll. And it's just a technique where you stop and you think about that thought, you take it in, like you said, you sit with it, then you drop it, you actually drop it in a notebook. You're putting it down, you're writing it down. It becomes more real, it becomes more silly or thinking like unrealistic. Am I really thinking that? And then you roll it into a more positive way of thinking this. And then lastly, you say it. So that thought written down, reframed, and you're saying it in a more positive light, we're actually becoming what we're saying. And there's some science to that. When we speak out loud of what we want to be and how we want to look at things, we actually become that. And so we may not feel it that way yet, but it doesn't matter if we're being intentional. We don't have to feel it quite yet, but we will eventually.
Yeah.
So I think that's what really helped me. Honestly, was just writing down some of those thoughts that were utterly ridiculous when I looked at them. When I looked at my notebooks, looking at all this, and I actually journaled quite a bit when I was in treatment, and kind of that was my way of kind of stewing and soaking and facing the stuff, a lot of the stuff that was being said. Because when you're first diagnosed, you get thrown a lot of information.
Yeah. Yes.
And you forget. And so for me, back then, I would probably suggest doing something in addition maybe to recording conversations, because there's a lot of information that you might miss that your doctor's telling you, or bringing someone else along to take copious notes, or whatever that looks like. But that really helped me, because I was able to actually see what I was thinking and see that that's just not going to happen. Why am I thinking that?
Yes.
But then there were times that could happen, and I needed to really deal with that. I needed to kind of reframe that into something that was manageable, that was more positive for me to be able to justify it. Yeah. I mean, what are some of the things that when you have a patient and you're working with that or that client, and you're working with them, and they're coming up with some really struggling thoughts, what kinds of strategies would you suggest?
Yeah, definitely. So I would say that in the moment, right, in the moment of feeling that fear, overwhelm, whatever it is, stopping, being with, and really acknowledging what is the fear that's behind that. Recognizing that many of our fears and our sadness and other things aren't necessarily about anything that's happening in the moment, right? They are caused by hypothetical, the what ifs, right?
Great storytellers, aren't we? Yes.
Right.
So true.
Yes, exactly. And so the more we can acknowledge, yeah, I am incredibly scared of this. And that's not happening right now, but I'm scared of it, and I need to feel that fear, and allow myself some time and space to process that, either alone or with a support person, right? Whether that's a family member, close friend, or other professional, allowing that time and space. And then, once you've had a chance to process that, really focusing on the present moment, right? This hasn't happened. This isn't happening. And I'm doing this test to really be empowered with the information that can help me if I need it, right? So that's, I would say, is a lot of the focus of the work, whether that's in a oncology survivor clinic, surveillance clinic, or here in my coaching space, and then it's a matter of spending time thinking about, what do you need, right? What do you need? What are strategies that help you when you're feeling super overwhelmed and anxious? What are some ways you can ground yourself and really allow yourself to focus on the here and now? And so I would say that's a lot of it. The other piece, right, is to really highlight, not from a creating dependence perspective, but more knowing for people who I'm working with to know that I'm here as a support, right? When you're having those overwhelmed feelings, if you're, maybe it's around the time of a surveillance scan, maybe something happens and you're like, oh my gosh, I have this pain and it's not going away. What the heck is this? Right? Frankly, I'm an oncologist. I do that with my own kids, with myself. I know, right? And so just to be able, as you said, to be able to put that out there, to not stew in it, to not keep it all in, but to really, whether it's journaling or reaching out to say, oh my gosh, I am feeling really terrified right now, and I just need a moment to check in. And so to talk through things and, can be incredibly helpful in the moment as well.
I totally agree. I think that's such great advice. I've worked with a woman who is a breast cancer survivor, and she just refuses to acknowledge her diagnosis. And so she refuses to, she's had, I think, chemo once, refuses to actually go back. She was required to go back again. And as a single parent, that's tough.
Wow.
And trying to stay strong for her child. But it's almost we are just refusing to acknowledge that we have this diagnosis, and that's a scary place to be. Yeah. I think, having cancer requires you to be courageous. Yes. You've got to be courageous on so many fronts. But this courage can help you in other ways in your life, in more meaningful ways in your life. Once cancer is gone and done, and the surveillance is done, you are a different person. And when you're living intentionally, and you're recognizing this cancer diagnosis, and you're sitting in that fear, and you're coping with it as best as you can, either alone or with a professional. Nonetheless, you're required to do intentional steps to get through that, so that you can process it and move on. When that cancer, then treatment stops, and your surveillance stops. Or at least it's more spread out. It's maybe you're seeing somebody annually now, and versus seeing somebody whenever it was more regularly. You still have to arm yourself with those tools in your toolbox to deal with those ideas that are not just going to go away. Now they might we hope less and less, but you certainly don't want to be at a point where you just forget, or you don't acknowledge, or there's a fine line there. We don't want to be victims, and live in a kind of a martyr role and be hypochondriac and I understand that. I've been there. Any kind of cough, I'm thinking, oh boy, has it come back? That lingers and goes on and on and on. No, it actually was a bronchitis episode, and you get it checked out, and then you're thinking, okay, this is not cancer, but it's hard. You have a new ache in a bone, and you have a cough that doesn't leave, and all your mind goes to different places. But I think it's embracing these intentional tools. If you can get yourself a toolbox and having these tools that you can pull out at different times in your life, it's going to be so measurably helpful. Cancer is just a means to an end. It's a means to developing these tools. But in some ways, aren't we blessed to be able to develop them? I mean, some people don't have that opportunity to be able to strengthen those muscles of pulling out something out of their toolbox and being able to say, I've got this. Like, I'm having a hard day today, but I kind of know what I need to do, and I'm going to be intentional about that, and I'm going to do this. And maybe cancer taught you that, and isn't that a good thing? Isn't that a thing that maybe we can be grateful for?
Absolutely. And I would say sometimes that doing is taking time to be, to just be, right? And to ground yourself and to take a moment. So, I love being able to really talk about and have conversations together about stuff like this.
Me too.
I'm sure people out there, our friends, our followers, our, colleagues and others, I'm sure you may have other strategies, thoughts, input, ideas, questions. We want to hear those. And so please feel free to share any thoughts, ideas, comments, and let us know so that we can, address those either in writing in response or even in another conversation. So
please do. And if you like what you're hearing and it's been helpful, please give us a 5-star review and subscribe and pass on, because we are growing and we really appreciate being able to get the message out there. We need your support. So we really appreciate all the support that we can get at this point. And it's always a joy, Jamie, to talk to you about these. I mean, I feel like we could talk about this like for hours.
Yes, absolutely.
But I hope it's been helpful to those listeners out there who are dealing with the waiting period, either before and after. I hope it's been helpful.
Yeah, definitely. Any closing thoughts, comments, words before we wrap up?
Oh, I feel like I am just grateful to be able to be here and talk about this and to be able to serve others, from our experiences. I mean, what a joy this is to be able to help other people with this. But again, if there are problems, concerns, issues, questions, comments, any of that, I encourage you all to please share with us, because we are here to serve.
Yeah, absolutely. Yes. All right. Thank you so much.
All right. Thank you. Have a great day.
All right. Until next time.
All right. Bye.
Bye-bye.
This podcast is here to support you. If you liked it, please rate, review, follow, and share, since that's the best way to grow a community together. Please leave us comments and feedback. We're here to help.